Thank you for joining me today.
Hey Laura, it's very nice to meet you.
Hey, it's good to see you.
Thank you for asking.
How are you enjoying the winter?
Oh, well, I finally get to spend time with the family for once. Usually I'm
Excellent.
busy doing paperwork and seeing patients and everything else, emergency calls.
I'm sure you're a busy man. And so you probably know what I've called you here to talk about today. I'm curious, why did you stop your private practice in our town in 2011?
All right, well, first off, it has nothing to do with the community. I love the community. I love the patients. I enjoyed being with the families and watching them grow. However, um, in 2010, the Affordable Health Care Act came out that made it very hard for private practices across the nation to incur substantial amounts of revenue. This was due to low reimbursement rates.
Oh, low reimbursement rates. Tell me more about that.
Yeah, okay, so let's say you care for a patient that would normally cost your private practice $50.
Okay.
However, you are only reimbursed $30 for that fee.
So you have a net loss then when you see that patient.
Yes, now this isn't always the case for all patients. Uh, Sometimes it evens out. Every now and then we get a net gain. However, this net loss has been happening a lot lately, uh, more prevalent, I would say, due to the Affordable Health Care Act.
I see.
Yeah. Now we can afford losing $20 every now and then. It's not that big of an issue. However, I gotta pay my nurses and secretaries some way.
So it cuts into your ability to substantiate pay for your employees
It
at
does,
your
yeah.
private practice.
So the money's not really ending up in the people that actually touch the patient.
I see.
Hmm.
And how has that affected the workload then for your employees there, such as your
Yeah.
paperwork?
Okay. Yeah. Certainly. So because each patient that we see, um, there's a chance that we may lose income. We have to see even more patients, and when we see more patients, we incur more paperwork. Now, the Affordable Health Care Act also released more forms that physicians have to fill out.
So there's more documentation happening.
Yes, per patient.
And,
yes.
and an increase in your patient load just to be able to afford your practice.
Yes. As a matter of fact, the amount of paperwork from within 20 years, it used to be 4 documents for a stroke case. Now it is 78 pages.
Oh my goodness.
Yeah,
That's
so you have in 78
exponential
pages.
increase.
Yeah, this decreases the private practice efficiency because now we're no longer able to see as many patients. We're not able to make as much revenue either.
I see. So, and what's the pre-authorization like then in your process there?
So the Affordable Health Care Act requires that physicians contact the insurance companies and ask, and the insurance companies will either approve the physician's method of treatment or disapprove or kind of limit what the physician can do. So let's say I think my patient needs a mammogram. Now, I will have a nice family history represented as well as possible lump. Uh, Now, the insurance company could debate that and say it's just a cyst. Uh, it's not significant. Get back to us. You could run a mammogram yourself, but it's going to cost your private practice personally.
I see. So there's a delay in the response, and in the meanwhile, your specialty of being able to diagnose really is delayed for the patient. Well, thanks for sharing with me today, Dr. Payne.
Yeah, Laura. Yeah, anytime. Thank you.